Hi everybody, I would like to start off by having you imagine that I just diagnosed you with a chronic kidney disease called C3 glomerulopathy, or C3G for short. Now within 10 years from today, or diagnosis, 50% of you will develop end-stage renal failure. Additionally, there are no commercially available therapeutic options for you, so everybody has potential to develop end-stage kidney failure. However, what we do know is that C3G is caused by overactivation of the alternative pathway, which is an immune pathway in your system. The alternative pathway normally functions in fighting off foreign invaders in your body. However, overactivation can lead to tissue inflammation and tissue damage as seen in C3G patients. Thus, what my research aims is it looks at two proteins called factor H and factor H-related 1. Factor H is you can think of as a brake in a car. It stops the system from progressing, whereas factor H-related 1 is theorized to be like the gas in a car. It's theorized to drive the system forward. So just like driving your car through the city, you need a balance between stop and go. This pathway also needs a balance between factor H and factor H-related 1. You need a balance foreign invader killing, but you also need to prevent tissue inflammation and tissue damage. So what I have done in my research is I have collected blood samples from patients with C3G from around the world, and I have looked at their factor H and factor H-related 1 levels. And as you can see in the graph, on the right we have C3G patients, on the left we have control patients. Each dot is an individual person, and we can see that in C3G patients it is elevated compared to controls. So through this we have identified a novel biomarker or diagnostic tool for C3G patients. And because we have identified this novel biomarker, we have also identified a novel therapeutic target for these treatment of C3G patients. Thank you.